Cerebral palsy means brain disease causing paralysis. It is a non-progressive neurodevelopmental disease. Cerebral palsy is caused due to abnormal development of the brain, damage to the brain, or damage to the developing brain, infection, or genetic mutation. Prenatal damage accounts for 70 to 80% of cases of cerebral palsy and is caused by radiation or toxin exposure, infection, hypoxia, and maternal or fetal malnutrition. Postnatal damage accounts for 10% of cases of cerebral palsy and is caused by hypoxia, infection, or head trauma. Birth asphyxiation is the most common case in postnatal damage. Hypoxia, oxygen deprivation, and fetal malnutrition occur from detachment of the placenta, uterine rupture, or an umbilical cord wrapping around the fetal neck of the infant, restricting oxygen. Maternal infections that happen are cytomegalovirus, rubella, herpes, syphilis, toxoplasmosis, and Zika. And intrauterine infections are infections of the placenta or fetal membranes. Conditions that cause bleeding in the third trimester, such as preeclampsia, a complication of high blood pressure, and placenta abnormalities can cause cerebral palsy. Symptoms of cerebral palsy are muscular and developmental. Cerebral palsy causes extremes in muscle function, a lack of muscle function, and extreme hyperuse. The muscular symptoms of cerebral palsy are a lost ability to prevent movements, involuntary out of control movements, muscle spasms, rigid and stiff muscles, permanent shortening of muscles, difficulty with movements such as walking, weakness in muscles, paralysis of one side of the body, and abnormal posture. The developmental symptoms of cerebral palsy are intellectual disabilities, failure to thrive, slow growth, and speech delay, such as a speech disorder or stuttering. Cerebral palsy is a broad umbrella term covering a variety of symptoms, and it depends on which part of the brain is affected. There are two ways cerebral palsy is classified. These two classifications are put together in the diagnosis through a developmental evaluation for the specific type of disorder and part in the brain and muscle that is affected. The first classification is about what is affected on the body. Monoplegia is one limb. Diplegia is the lower half of the body. Hemiplegia, one side of the body. Quadriplegia affects the whole body. The second classification is about what in the mind is affected. Spastic cerebral palsy is the most common type, and there are two types, unilateral and bilateral spastic cerebral palsy. Spastic cerebral palsy is characterized by tight muscles resulting from a lesion, some abnormality in an upper motor neuron, messing with the ability of some of the neurons to receive GABA, the main inhibitory neurotransmitter, impairing the ability for neurons to receive GABA. This leads to overexcited nerves causing hypertonia, which is abnormal increase in muscle activity. Hypertonia presents in muscles that are always flexed. An example of this is individuals with cerebral palsy who have that scissor gait we just talked about. Another example is when the calves are always flexed, pulling the Achilles tendon up, causing an individual to go up on their toes and walk that way. This is called a toe walk. Dyskinetic, another type of cerebral palsy, results from damage to the basal ganglia or the thalamic as a result from a brain injury. It occurs during late pregnancy or in the early birth period. The basal ganglia is the part of the brain that helps us initiate and prevent movements. The thalamic is responsible for relaying sensory and motor signals and regulating consciousness and alertness. Damage to the basal ganglia or thalamic results in individuals losing ability to prevent movements, have involuntary out of control movements, and a normal posture. Damage to the thalamic can also cause loss in sensory and motor signals and could cause a loss of consciousness and alertness as well. There are two types of dyskinetic cerebral palsy. One, dystonia, which is random, slow, uncontrolled movements in the limbs or trunk of the body. Two, chorea, which is random dance-like movements moving from muscle to muscle. In the case where there was no postnatal or prenatal traumatic event, cerebral palsy is a result of abnormal brain development or genetic mutation. The genetic finding in cerebral palsy is heterogeneous, so it's difficult to identify the exact cause. However, some of the genes that have been identified in families were the AP4 complex, adaptor protein complexes, and CANK1. CANK1 mutations have resulted in cerebral palsy quadriplegic type 2. Ataxic cerebral palsy results from damage to the cerebellum, which is the third type of cerebral palsy. Now, the fourth type, mixed cerebral palsy, occurs when the brain has injuries or lesions in several locations. When it comes to getting a diagnosis, Either the primary care doctor, a developmental or neurodevelopmental pediatrician, a child neurologist, a pediatric psychiatrist, or pediatric rehabilitation doctor will conduct the developmental evaluation. The doctor looks closely at the child's motor skills, reflexes, posture, and muscle tone while taking a careful medical history from both parents for genetic causes. A diagnosis is usually given within the first or second year after birth. The developmental evaluation starts with a visual screening of movement or motor delays, starting at 9 months of age. Mild movement delays might be easier to see when the child is 18 months of age. Most movement delays can be found by the time a child is 30 months. Additional tests such as imaging tests, MRI or CT scans, EEGs, genetic testing, or metabolic tests are used to find the cause of cerebral palsy. Many of the children with cerebral palsy also have other related developmental conditions, such as intellectual disabilities, seizures, vision problems, hearing problems, or speech delays that they are evaluated for. The most common and effective treatments are stretching, exercise, physical therapy, medication, orthotic braces, and surgery. Spastic cerebral palsy causes overexcited nerves, leading to hypertonia. Hypertonia is when the muscles are always flexed. So stretching is very effective in isolating body parts and preventing too much flexion. A commonly used stretch for this is lying prone or on the back and reaching for objects to hit, grab, or touch. Orthotics can help spread the toes on the foot if there is restricted movement of the toes. Medication prescribed for cerebral palsy can be muscle relaxants or botulinum toxin in the form of injection for pain management to relax the muscles and reduce hypertonicity. Surgeries are performed to loosen tight muscles or cut nerves to reduce muscle spasms or associated movements. Also, to straighten out bones that muscles have bent over time, or to put in a G-tube and or catheter. A G-tube is a tube inserted inside of the belly to bring nutrition directly to the stomach. This is especially helpful in the case if someone with cerebral palsy cannot eat or even talk or use their mouth very effectively. A catheter means a tube. A Foley catheter specifically are flexible tubes inserted inside the bladder to collect urine. The average lifetime costs of treating cerebral palsy are an estimated $900,000 for doctor visits, surgeries, and any adaptive equipment. For an individual with cerebral palsy, treatment is lifelong. Cerebral palsy out of all childhood disabilities is the most common. In the United States, cerebral palsy affects approximately 3 live births out of every 1,000. Currently in 2023, an estimated 764,000 children and adults have cerebral palsy. 500,000 children under the age of 18 currently have cerebral palsy. 2 to 3 children out of every 1,000 have cerebral palsy. Unilateral spastic cerebral palsy accounts for 30% of all spastic cerebral palsy cases. Bilateral spastic cerebral palsy accounts for 69% of spastic cerebral palsy cases. Unaccounted spastic cerebral palsy accounts for 0.7% of spastic cerebral palsy cases. Dyskinetic cerebral palsy occurs in 6% of individuals with cerebral palsy and has an incidence of 0.14 cases per 1,000 live births. Ataxic cerebral palsy occurs in 6% of individuals of cerebral palsy, and an estimated 3 to 8% occurs in live births.